It's an Ask Anything show, but we're counting down to New Year's resolutions and how to keep them. Tonight, On Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. Dr. Holm is off tonight. I'm Dr. Jill Kruse of Brookings Medical Group. You may want to stop smoking, lose weight, or learn a new language. Many of us make these plans or resolutions at the beginning of each year, often to be unfulfilled in just a few weeks. First, let's take a look at this week's Prairie Doc quiz question. If you decide to use the South Dakota Quit line to stop smoking, how many phone coaching sessions does someone normally have? A, 7, B, 5, C, 12, or D, 9. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of Dr. Holm's book, The Picture of Health. Each of Dr. Holm's essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We will announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. We answer your medical questions about anything, especially, but not only, about resolutions, as they're called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us tonight are Doctors Kelly Evans and Andrew Ellsworth of the Brookings Medical Group. Welcome, Kelly and Andrew. Did either of you make a New Year's resolution?
I did, in my head, make one or two. I decided that I didn't like how too many emails pile up and then sometimes I don't get to them. So I try to get to a bunch of them the end of the day, or at least the end of that weekend if I didn't get to them. I'm going to have a bunch to do this weekend.
I did not. I'm going to be honest with you. I tried to make a healthy change a few months ago when it came to exercise for me, so I'm trying to keep up with what I started in October.
All right, so you had a jump start on it.
Yeah, something like that.
Excellent. All right. Well, I know you'd also mentioned when you were learning to say no with grace and ease, and unfortunately I still suckered you into coming on the show.
Yeah.
So we'll let you keep working on that.
The weather came up and someone stopped by my office yesterday.
Yes, so.
Unfortunately, I don't think any of us can say no to Dr. Holm, unfortunately, is maybe our issue. But,
there you go. But more practice to success in the future. So. All right, well, great. Well, I've been working a little bit on a New Year's resolution. One thing that I did at a conference was 3 good things. And just at the end of the day, I sit down with my kids, they have a little journal, and we write down 3 good things that happened that day. And one, it's painfully slow to watch my first grader write, but he is practicing his penmanship and we're practicing gratitude. And it's been just a wonderful bonding time with the kids and learning about what happened at school and what's been going on in their life. So that's been our kind of special moment to kind of wind down as the night's going on. So it's been a fun resolution.
I've heard more about people talking about the importance of gratitude and how that, if you focus on something every day that you're grateful for, how that can really make you feel better, you know?
Yeah. I think we all probably know that intuitively, but to put it into practice in a more tangible way, I'm sure is really feels good at the end of the day and hopefully puts things in perspective.
Yep, and now my kids have these little bullet point journals of 3 things that happened every day, and it's kind of fun to flip back and look.
Yeah.
And it's been a great thing. So.
Yeah.
So not all resolutions have to be about, losing weight or stopping smoking or giving up something. It can be adding.
Right.
Adding something good.
That's a good point.
Yep, definitely. So, anything else that's been going on with this holiday season that?
It's of course really cold again now, and one thing we did over the holidays was my wife and I and our 2 little children just stayed home over New Year's for 3 days in our pajamas, and I think that was a good lesson in how wonderful it can be to just enjoy each other's company and not be so busy all the time. So that might be another good goal for the new year.
Very good goal. Learning about margin and taking space and time. I always remember I had a teacher that once talked about how there's margins on the edge of your paper or it's impossible to read something. It gets too cluttered and busy, and that your life needs to have margin in it too, and that breathing room where you can sit and reflect and spend time with family and just think about what is going on and what you want and have a really meaningful time that way.
Great. Yeah. And I would say, you know, sometimes January feels like a painful time. You're on withdrawal from all the excitement of the holidays, and it's back to work, and the weather is awful. But for me, there's a little bit of relief that comes with that, too. I have two twins who are almost 2 years old, and so traveling over the holidays is hectic, and getting 2 1-year-olds out of their routine is painful, as probably most parents or grandparents might know. So it's kind of good to be settling back into a routine and getting back to work and all that stuff that goes along with January.
All right. Well, we have our first question here. A 74-year-old woman from Huron is having a hard time getting around on the ice and worries about falling. Are there any easy tips for her to stay upright this winter?
We do know that physical therapy is important, or it can be a nice way to help with get your strength back and help with your balance. There's different exercises they can help you with to help prevent falls. Make sure that you can see well, maybe getting your eyes checked, that your glasses have the right prescription, that you don't have cataracts. Cataract surgery is one of the things that's been shown to help prevent hip fractures, because then if you can see better, you're less likely to fall, you're less likely to get dizzy and such. So I mean, those are a couple examples.
Yeah, and I mean, there's no two ways about it. Sometimes your front stoop is icy, and so there has to be some precaution that a person takes to make sure that the snow is getting shoveled and you're getting salt on the ice or whatever you need to do. And sometimes for a lot of my patients, I hear that involves some sense of a community. They have a neighbor who comes and does that for them whenever it snows. And it's really nice to hear that, because I guess what I would say is, if you're someone out there who's not the 74-year-old worried about falling and you have a neighbor who is, do a good deed next time it snows and go shovel the stoop for your neighbor and that kind of thing, because it could prevent something from kind of catastrophic from happening. But there's a certain amount of care that just needs to be taken when the weather's like this.
You know, I'd also comment on proper footwear, of course, and trying to keep a lower center of gravity. You know, if you are in a situation where it's a little uneven or something, just try and walk more carefully and just like think about walking on a canoe. You know, you want to kind of stay low and go slow.
Great suggestions. Wonderful. So looks like they're working on a. Oh no, they're not. Must have answered a question. So. Have you guys had a patient come in and talk about their New Year's resolution since the new year and what that means? I know that I've had a handful of patients come in and talk about wanting to lose weight, and I don't know if that was actually their New Year's resolution or if it was a coincidence, but I'm hearing that more, and maybe that's just goes along with this time of year.
There's certainly more commercials.
Yes, yes, there's a little more peer pressure right now.
Right.
Yeah.
You know, what is the key to weight loss? I don't know. You know, I think one of the keys to any change you want to make is just making small changes. You know, picking one goal that you're going to do. You know, so many times we think we're hungry, but we're actually thirsty. And maybe if you had a glass of water first before having a snack, maybe that'll take care of your hunger or your thirst. And so that might be one little change you can make. I'm going to have a glass of water, or I'm going to get rid of pop, or I'm going to drink one less pop, or only have pop once a week or something. I mean, people have lost a ton of weight just quitting pop. Those little changes can just really add up, and it, you know, the weight loss is probably isn't going to be overnight, but when it is, it's probably not as healthy or sustainable. So
yeah. Exactly, and I tell, when I have a patient come in wanting to talk about the logistics of weight loss, obviously, if someone had invented the magic pill, that everybody would know about it, and that would be a very rich human being, and we just don't have it. So, I try to have a patient go through what their diet looks like in a day and what their activity looks like, and finding out, figuring out one or two things that they could maybe change that might cut a couple hundred calories out of their day-to-day diet. And in most people, that's not hard to find the one thing, and the harder part is doing the hard work of actually not eating those 3 Oreos that you eat every day or whatever. But I think if I tell people to actually write down what they eat every day, and there's some free online tools and apps on your phone that you can use to help you with that, but that can be pretty enlightening as to where all your calories are coming from. So that's a great first step, I think, in figuring out how you're going to cut out some calories from your diet in a sustainable way. I agree.
Sounds good. Well, we all have dishes we love to eat that make us feel warm and loved. Comfort food tends to be high in fats, carbs, and other ingredients that are not good for us. There are some adjustments that you can make to help the recipes.
When the temperatures drop and the daylight hours are shorter, energy levels can take a dip, right along with mood. We all run the risk of being less active in the cold winter months, making it important to focus on nutrition. Seasonal affective disorder, which is a type of depression with a seasonal pattern, can change mood, energy focus, appetite, and sleep. Consuming some of these antioxidant and fiber-rich foods can help improve these symptoms. Salmon contains a precursor to a neurotransmitter associated with mood regulation. Salmon also has omega-3 fatty acids, which have been shown to help manage depression. Try salmon using a marinade or sauce, or even over a salad. Clementines are an adorable winter citrus packed with vitamin C and fiber, among other nutrients. They are great to snack on or add to a salad. Winter squash is rich in vitamin A and carotenoids, which have been shown to benefit heart health and immunity. Try roasting your squash with a dash of cinnamon for a change of flavor. Sweet potatoes are an excellent source of fiber and are packed with vitamin A and potassium. Enjoy these baked, roasted, or mixed into foods such as oatmeal. Cauliflower has been noted for its high phytochemical content and potential to help prevent cancer and inflammation. Try it steamed or roasted on its own, or add it to stir-fry, mashed potatoes, or other common dishes.
This is your show, and your questions are the key to our show discussion. Call in your questions to 1-888-376-6225, or send us an email to ask@prairie.org. So while we were away, we have a few more. So a woman from Sioux Falls has low thyroid, but wonders, what does the thyroid actually do? What are the symptoms of thyroid issues, and are there ways to regulate thyroid besides medication?
So the thyroid is what we call an endocrine gland that lives here in the neck, and it's controlled in a really actually complex way from a gland within the brain. You can have problems with too much or too little thyroid, and those obviously cause different symptoms. The more common problem is too little thyroid hormone being produced. And symptoms can be quite vague, actually. A lot of folks will have fatigue, they might gain weight, they might have dry skin, and some symptoms that could be caused by many, many things. That said, thyroid disorders are fairly common, so your physician's often on the lookout for these things, and I wouldn't say they go undiagnosed for long periods of time very often if people are seeking medical care. Can the thyroid disorder be cured without prescription medication? The answer, frankly, is no. I mean, sometimes people have minor thyroid lab abnormalities, and often we'll just watch those people if they don't have symptoms. But there's not a sort of natural way to get your thyroid working better again, per se. In the case of too much thyroid, that can actually be dangerous if it's untreated. It can lead to heart arrhythmias and heart failure and that kind of thing. So unfortunately not a sort of natural, quote-unquote, way to treat that. But the medications we use for low thyroid are essentially a synthetic version of thyroid hormone designed to do just what your thyroid did.
You know, I've seen it so many times where someone's thyroid level was a little off while they were seen in the emergency room or they were in the hospital. So I think, you know, when you are sick, it can throw it off. And so it's important, instead of just immediately going on medication or you know, getting it rechecked again and seeing what it is over time, like you said, watching it.
Before committing someone to a lifetime of medications, especially if the abnormality is mild, it's very reasonable.
Yeah.
All right. Next question. A gentleman from Alcester says he has never had a colonoscopy and he's 60 years old. He's curious about the new DNA check, and wondering how accurate that test is. Is it a good substitute for colonoscopy if there's no red flags?
So the Cologuard test and some other DNA tests like that, you know, they're looking at the stool. It is looking like a really promising test, and a lot better than some of the other stool tests we've used to help screen for colon cancer. If it's a good result, you know, I think that is really helpful. If it flags something, you're still going to need the colonoscopy, and no test is ever going to be perfect either. And even a colonoscopy isn't always perfect, and there's risk with that. You know, if it came back abnormal, then you know, the test isn't going to take care of the problem. We still need to find out what the problem is. And so that's the nice thing about a colonoscopy, going in, looking in, and taking off a polyp and before it grows up into cancer. You know, we are making some progress with cancer, and especially in the colon cancer realm, it's been successful because we're not just catching it early, we're catching it before it's cancer. And I do colonoscopies for my patients, and I've had a lot of guys in their 60s show up, and they've never had any issue, and they don't see why they need to do it, but they finally did it, and we went in there and saw a big polyp and took care of it. And I'm just so glad. That's what's exciting for doing that procedure, because we can stop these things before they grow into cancer. And but the cancer rates, I wanted to, you know, I saw a study recently that was saying that like compared to 1991, the cancer death rate per 100,000 people in a given year was somewhere around just over 200, and now it's somewhere around over 150. So we're making some progress with all these screenings that we do, but there's a lot of work to go too.
Yeah, and you know, those fecal tests, there's a handful of them now, and they are very what we call sensitive. They don't miss a lot of what we would be worried about. The issue is they're going to have false positives, and they need to, essentially, if you think about sort of the statistics of the test. And what I tell people is, if you are going to tell me that there is no way anybody is ever going to get you to do a colonoscopy, then I would say there may not be a point in doing that stool test, because you're right. If it's a positive test, then that's what I'm going to tell you. You got to have a colonoscopy. So I think just being aware of what the next step would be before you do a test is important. Yeah. And those, if you choose those for screening, they need to be done every year.
Yeah. And you have to consider the cost. It might take a while before your insurance company covers that test. So this might be an out-of-pocket cost that you're paying for. Don't just assume they're going to cover it for you. And some of them right now, you deal directly with the company and you don't bring it to your doctor.
All right, well, very good answers. So next question, a woman from Brookings is asking about acupuncture. Does it help with appetite suppression or cravings? And if so, who does acupuncture in Brookings?
So I guess I'm not aware of any studies that have given a positive test for that purpose, for weight loss purposes, appetite, that kind of thing. There are some studies that have shown acupuncture is promising for things like chronic back pain and some other more syndromes like that. There was a study published about whether acupuncture versus what we call sham acupuncture was effective for perimenopausal symptoms, and it wasn't. So there's actually more scientific studies coming out about acupuncture, which I think is great. So I think it can be useful in some syndromes. I don't know that there's a verdict on that particular thing. I know there's a handful of chiropractors in our community who do acupuncture in a very safe environment.
Yeah, there can definitely be some medical benefits, and in some ways, whether it's acupuncture or massage or meditation or prayer or whatever else, or yoga or whatever else you want to do that can help you relax and help you decrease your stress level, that's going to that has humongous health benefits to you in general, and maybe that keeps you from having some of those cravings or trying to use food to fill that void or to relieve that stress, rather than, or alcohol or tobacco, or maybe this is a much healthier alternative way to deal with stress. So,
yeah, very good point. So, next question: if you have flu-like symptoms, should you wait out the illness or be seen by a physician?
That's an excellent question, and I think that part of that depends on you and your medical history and how severe your symptoms are. So certainly if you're someone who has underlying lung disease, if you have asthma, if you have COPD, or if you have an immunodeficiency of some sort, if you have some of those illnesses, you should absolutely be seen if you think you might have influenza, because it can be a severe disease. I would say if you're sick enough that there's a question in your mind whether you should be seen, then I would err on the side of being seen with this flu season, because we've seen there have been a lot of deaths already this year. It may be a fairly severe flu bug this season, and even just having someone lay eyes on you, check your vital signs, can help us understand whether we need to do something more than just watch and wait, which often that might be the answer that you get, and that's okay, but there's not really a substitute for having hands and eyes laid on you.
I mean, I've had so many patients that thought they had the flu and it was something completely else going on, and it can matter how soon you get help. With that said, yeah, there's plenty of patients that may get the flu, influenza, and there is maybe nothing we can do to help. But hard for us to say for sure what's going on if we haven't laid eyes on you. But in general, of course, still getting your sleep, getting having enough rest and fluids, and not trying to push,
Right.
letting your body heal.
And I would say if I see a patient that I think, either by testing or just by the syndrome, that if I think they have influenza versus something like the common cold, I'm a little more strict in the direction I give about returning to work and exposing others to that illness too. So I think it's probably worth seeing your physician if you are getting sick, especially if you know you've been exposed to influenza or something like that.
Yeah.
Yes, because it's not just you that you're worried about, it's everyone else that you're around and possibly exposing. So that's always something to take in consideration. Sometimes going to work sick isn't really helping your coworkers.
One thing I want to differentiate, sometimes influenza hits just like, they feel like they got hit by a truck. All of a sudden they got fevers, chills, body aches, a cough, maybe they threw up, maybe they didn't. We're not talking about the stomach flu, which is the vomiting and then diarrhea, and it's over in 24 to 36 hours. And we're not talking about the bad cold that you had a little sore throat and then you had this cough that won't go away for a week. A little way to differentiate those there.
Yep, there's a lot of different things that can kind of present similarly, and sometimes, yes, what we call the flu and what someone else may call. I know there have been many times where what was described and the actual diagnosis didn't always match up. And I always tell patients, I can't diagnose over the phone. I like to see, hear, listen, touch. There's so many more things that go in than just listening to the story and listening to you cough over a phone.
Yeah.
Or a computer screen.
Or a computer screen. So yes, please
yet.
come in. So, all right. We have a gentleman from Sioux Falls asking, what causes prostate cancer and what are the treatment options?
So the prostate is a gland for men only, down, down near their rectum and their urethra. It runs through this, so the urine, your bladder sits there, and the prostate sits right under it, and the prostate naturally enlarges as you get older. And so this can put a little pressure on your bladder and make it harder to urinate. So you might end up actually urinating more frequently because you're not really emptying your bladder completely. So sometimes people say, I have no problem peeing, I have to pee all the time. Well, maybe you're not actually urinating completely, avoiding completely. And then you might go more frequently. You might notice dribbling more or weaker stream. What causes prostate cancer? The cells in that prostate can change and turn into cancer, and we often don't know exactly why, but it's really common. I mean, some say if you live long enough, 1 in 3 men will get prostate cancer. In general, 1 in 7 men as a whole are at risk for prostate cancer. It can run in the family. We don't know there aren't really many specific causes. I mean, smoking increases all risks of cancer, but in general, it just happens. And we have various ways to treat it. Nothing is perfect or a guarantee, and sometimes we can cause more harm than if we hadn't treated. But because it can be a slow-growing cancer, and this, of course, can be its own show and has been its own show. But unfortunately, it can be very devastating and can spread everywhere. And it's a tough personal subject for many men and many families. And it's just best left in a conversation between you and your doctor, really, on how to look for it and how to deal with it.
Yes, so. And a gentleman from Yankton asks, does eating a large meal before bed hurt sleep and digestion, or is that just an urban myth?
So I think there's a few ways that eating late, especially if it's a large meal, might affect one's sleep. And one of those ways might be from something like acid reflux, something that a lot of people are familiar with. I don't know that across the board, is everybody going to be negatively affected by that? No. This is going to be an individualized thing. Naturally, your body's metabolism is going to slow down overnight as you go into sleep mode, and so you're going to burn less calories. And so, in theory, the sort of diet gurus will tell you don't do that. Don't eat it after 7 o'clock or whatever the mantra is. And there's probably truth to that, but it's probably not going to affect everybody's sleep in a negative way, but it could.
And plus those with reflux, acid reflux,
yes.
When you're laying flat, you don't have
Yeah.
that gravity to keep that stomach acid down, so that can definitely worsen it.
On the flip side, for those trying to lose weight now with the new year, it can be really important to eat breakfast.
Yes.
That helps to speed up your metabolism and get that going. And many studies have shown the benefits of just eating breakfast no matter what it is, let alone that oftentimes it's one of our healthier meals of the day. And it doesn't have to be large, and it could just be half a banana, something quick and easy or whatever. But it can, I heard once that sumo wrestlers eat all day long because they want to gain weight and be big, but they skip breakfast because then otherwise they won't gain as much weight. So.
Interesting.
So don't be a sumo wrestler.
Most of us don't want to be a sumo wrestler.
All right. Well, variety is the spice of life, and sometimes it is spice that brings variety to life.
The diets, they vary a lot because they are from different regions, like in US and in India. Because of the resources, one thing that's a difference of diet. The other thing is that the spices make a lot of difference. There are lots of spices. I just brought a few of here to talk about that. Turmeric, it's an all-round spice that can be used for anything. From your everyday cooking, plus if you have a cold, you can use it. If you have a sprained ankle, you can use it. Ajwain also is very good for you because it helps your digestion, it helps with your gastric problems. Whenever you're cooking with anything with the beans or any high fiber diet food, then you want to add ajwain to it that really helps digest and get rid of the gas and gastric problems. Black cardamoms, they grow in northern India, and that's the only place they grow. It is used mostly in northern India in their curries. Black cardamom helps with the acidity. If you have acidic problems, then you can use that. It's really, really good, and I personally have used it, and it has helped me. Then you have your nutmeg. Nutmeg, of course, gives a nice flavor to your desserts and all the food, and also it has kind of a chemical that helps you make sleep. And fennel also is good for your digestion, also good mouth freshener. Cardamom, of course, it has the, when you go to the dentist, they use the Novocaine that has the oils of the cloves. And cardamom also very good, similar to green cardamom grows in southern India. So two difference, one is green and one black. Cinnamon is an all-round spice, good for you everywhere. Saffron comes from a crocus flower, a stigma of a crocus flower. So when you pick a flower, it's a purple flower, it has two stigmas, so you have to collect like thousands of pounds of crocuses to make this much saffron. So this is, it's called asafoetida. It is used like a pinch in your food. Not so much because it's very pungent, but it has a little sweeter taste when you add it to it, and it's very good for your body. It helps your brain function better, and it charges your brain in a way. I would like to have them use more spices in their diet, and don't be afraid of spices. It's really beneficial to use, and don't be afraid, use anything. It doesn't have any side effects. So that would be my thing, to have them use more and incorporate more spices in their diet.
Well, great ideas there. So kind of getting back to our New Year's resolutions and plans for the year, what 3 things would you recommend patients do, or what good advice would you give them for making these healthy changes?
So, you know, we still see plenty of patients who smoke and are addicted to tobacco. And there's a lot of things that we can talk about healthy lifestyle, but to me, quitting smoking in a smoker is number one as far as how to reduce someone's risk of so many different diseases and kind of devastating diseases. So if I have someone who smokes cigarettes, that's always my priority. And so I always ask people, is today the day I'm going to convince you to quit smoking? And sometimes the answer is no, and that's okay. If someone's not ready themselves, then I'm not going to make them ready. But every once in a while I get a yes there, and a lot of folks try quitting many times before they're successful. It's hard to quit smoking. I don't know personally, but it is clearly really hard to quit smoking. And so I encourage people, if you've tried 6 times and gone back to smoking, that's okay. Try again, and maybe we try something different this time. So if you're thinking about that in this new year and want some help, talk to your doctor, look into the Quit line. There are resources out there, and it really is my number one thing that a person could do to improve their overall health.
Yeah, I mean, nicotine is one of the most addictive substances, period. And yes, some people can quit on their own, but it's extremely difficult. And you can improve your odds by 50 to 70% by trying something to help, whether it's patches or gum or whatever, or the Chantix or one of the other medications. And you can combine some. You could do a patch and then a gum once in a while when you need to. And so have that conversation with someone. Find an accountability partner, someone that can maybe quit with you, or that can ask you at the end of the week, how did you do this week? Don't get down when you fail, when you relapse. Those will happen, and they do happen. But every time you try, your odds improve that this will be the time where it works. The other thing I'd say is that it can help to put yourself in a situation where you don't have the same triggers. Quitting smoking can be a lot more effective or easier if you do it on a vacation. You're not surrounded by all the same people and all the same triggers, and so that can be a helpful way too.
I can't tell you how many times I've had a patient who got sick enough that they were in the hospital for 5 days for whatever reason, related to smoking or not. And then they come out, and that's the time that we say, okay, you haven't smoked in 5 days. Let's take advantage of this and see if they're mentally ready. Then that's a great time. And I agree. You know, often we see a patient who might be ready to quit, but their spouse still smokes, and that's going to be really hard to be successful if there's cigarettes and all that stuff around. So there are some behavioral things that your doctor can help you with, a quit line counselor can help you with, just to maximize chance of success.
All right, and we can put up the South Dakota Quits number there, so if any of this is resonating with you or making you just want to make some changes, there's the number that you need to call. These people are professionals. This is their job. They like helping people stop smoking.
It's never too late to quit.
It is never too late to quit.
No.
Yeah, I always tell people, even one less cigarette a day, that's 365 fewer cigarettes for that year. That means something. So even little changes can help.
And more money saved.
And more money saved. Excellent. Well, our next question. A man from Aberdeen asks, can the family physician or internist do a colonoscopy, or does it require a surgeon? Andrew, I'll let you answer this.
It does not require a surgeon. Thankfully, there's plenty of surgeons that do them and plenty of gastroenterologists that do them, but there's also plenty of primary care physicians who do them. I know Dr. Kruse that you perform them as well, and Dr. Holm is a general internist, and he did, and I do them regularly as well. And I think it takes a village. I mean, you know, there's some patients I've had where they didn't get talked into having it done until they saw me, and I think the benefit was that it kind of got rid of the middleman. They knew me, they could trust me, and we just set it up for them and did it, and sometimes they had a big polyp or something, and so I'm really glad we did it. And so, you know, there's so many different types of doctors that can help you with the same problem sometimes, and sometimes if you're running into feel like you're running into a brick wall with a problem, not just with colonoscopies or anything, but you know, with any medical problem, maybe you need another opinion, and don't feel afraid to find someone else.
Yeah, and so that's essentially provider and community dependent who is going to be available to do that. And in our community, we have surgeons and family practice doctors, and we did have an internist all who did colonoscopies. In a more urban area, it's probably going to be more specialists. Gastroenterologists are going to do the bulk of those. I'm an internist. I was not trained in colonoscopies. I have no intention of doing a colonoscopy on anyone. So it depends on where you live and what doctors are available and what they personally trained. And you have to have a certain amount of numbers of that in your training to be qualified to do that. And so not everybody pursues that.
And a hospital won't gain privileges to someone they don't feel is adequately trained. So that's always a good thing. So next question. A man from Yankton asks, does your own thyroid stop working when you get on the medications?
It, you know, you talked about the gland in the brain that's telling the thyroid to make the hormone, the thyroid hormone. So you've got the thyroid stimulating hormone, TSH, and that's the one doctors often check the most. And there can be a slight decrease in that thyroid stimulating hormone when you're taking hormone medication. And that's the goal, because if it was high, that means it was saying, hey, you need to make more thyroid. Now we're taking thyroid, so the body's helping to bring that back to within normal where we want to see it. You take too much thyroid medication, then the TSH goes too low. So it's saying, hey, quit making so much thyroid to the hormone, to the gland, the thyroid gland. And so, taking too much medication can make the body make less of its own natural thyroid. You know, that's the idea. We're trying to find that even
sweet spot.
Spot.
And we don't think that alters the course of disease. People who have autoimmune thyroiditis, which is the very most common reason people have too little thyroid hormone, that's something that doesn't go away with time. And so we wouldn't expect thyroid function to return in that case. There are a few less common cases in which that does return, but that usually looks a little different clinically.
And it's not like your body's becoming dependent on the medication because you're taking the medication. But your body needs the thyroid medication. I mean, there's times where maybe the end of life we stop lots of medications, and we often keep the thyroid medication on because it's important and can help with your energy and your mood, and so you don't get constipated too tired all the time and so on. So.
All right, excellent. Well, we got lots more questions
Good.
here.
All
So, does coffee contain antioxidants? And what about decaf? Does that change the answer?
I mean, I think the answer is yes. I'm no expert on this except for the fact that I drink plenty of coffee myself. We've actually seen more studies saying coffees may be good for your health in moderation than the opposite. That being said, there are a handful of disorders in which caffeine can be harmful, and some acid reflux might be one of them. Heart arrhythmias might be one of them, and so this is a little bit individualized. But I guess I don't know the difference between caffeinated and decaf coffee in what that concentration would be. Mm-hmm.
Granted, of course, if you want to go to sleep that night, and if you're someone who's used to a lot of caffeine, it probably won't affect you, but if you're not, it may make it hard to sleep. The three of us are just drinking water. This isn't coffee. But I have, there's been plenty of studies out that showed some health benefits of coffee. Now, is some of that, well, maybe if you're drinking coffee, you're not drinking pop or whatever else, it probably be less healthy than for you, and so I think coffee can be a really nice option. I think everything in moderation sometimes.
Exactly. All right. Well, a woman from Lenox wonders if the flu shot was not as effective this year, and do the flu deaths come from the influenza itself or from a secondary cause?
Great question. So the verdict is still out on how effective our flu shot's going to be in the U.S. this year. It's too early to know. And the numbers, we take some early data from Australia because their flu season is different in the southern hemisphere, and it was not very effective there, unfortunately. That's where you hear some of these 10 and 20% numbers on the news. I don't think we're going to have the greatest year for the flu shot, but it might be similar to last year, somewhere like 30 to 40% based on early data. As far as deaths, the answer is both. You can die from influenza without a secondary cause. It can cause septic shock, it can cause respiratory failure, and all those things. And then, a handful of folks do get a bacterial pneumonia on top of their influenza, for example. But the flu itself, in severe cases, can cause death.
Yeah, I mean, we've seen it take very healthy young adults. Sometimes it can be very tragic, and that's why we want to do what we can. And know the flu shot isn't perfect, but we do know it can help, and so that's why doctors often recommend it. But yeah, it's not perfect.
It's not perfect, and it's really hard for us to show in a scientific way that getting the flu shot decreases severity, because I can't get the flu without the flu shot and get it with the flu shot, if that makes sense. You can't compare those two things, but we think that that's true based on some immunologic data that we have, and so. Do you have a friend that got influenza even though they got the flu shot? Maybe, but might they have been sicker? There's a good chance that that's true.
Excellent. So, and it's not too late to get the flu shot. If it's still available,
It's not.
we're still giving
Flu
it.
goes strong till March or April, so you might still get some benefit out of it.
And I always tell people, any amount of coverage. I mean, if I were out somewhere and you offered me a 30% bulletproof vest, that's better than none.
Right.
And if I get shot, it's still going to hurt, but at least I'll be alive. So.
And the truth is, there's some chance that my flu shot from 4 years ago might help me this year too. So getting it every year exposes you to different antigens every time, such that your immune system might recognize the new flu bug that emerges. So.
Yeah.
Yep, excellent. So an Alcester woman wonders, how necessary is it to wipe down the supermarket carts with sanitizing wipes? And do they need to worry about even the touchscreen kiosks at restaurants without the wipes?
Do you guys wipe down your supermarket carts? I confess I don't. I'm like the anti-germaphobe.
I have occasionally, but otherwise I normally don't. Flu season's not a bad idea to do it.
Right.
Or at least don't push your hand on the cart and then lick your hand.
Yeah.
But yeah, all these things that we're touching, and it could have germs, but I don't want to have, we also have our immune systems to help to try to fight off some things too, and we have to exercise our immune systems. It's interesting, in third world countries, they have a lot lower rates of allergies because their body's naturally fighting off things it needs to fight off. And here, sometimes we're so sterile, our bodies aren't sure what to fight off, so it starts to fight off things that we'd rather it not fight off, like peanuts, and then we get more allergies. So
exactly. All right. A man from West Webster asks, what causes kidney stones?
So there's not a single answer to that. There's a handful of different chemicals that essentially consolidate into a stone in the urine, and some of those things are something that you can't really do anything about. There are maybe some dietary measures you can take for certain stones. Maybe for a certain stone you could even, there's drug therapy for that, but often there's not necessarily a definitive thing you can do to prevent it from happening if you've had one. It depends on what type of kidney stone, and the only way to do that is to take the stone to the lab.
Yeah, I mean, getting dehydrated sometimes can trigger it for people.
Yep.
Because the more concentrated your urine is, the more it could form a stone of whatever is being concentrated in there. But yeah, some people just get them and some don't, and that's true for so many things in medicine.
Exactly. So a gentleman from Sioux Falls asks, how key is sleep for health, and how much sleep should a 55-year-old be getting?
I don't know what our internist will say, but I think in general we've said somewhere between that 7 and 9 hours of sleep is from what I've heard for that age group.
Yeah, and I tell people, I often have people who are older than that come to me thinking they have sleeping problems, but actually naturally as people age into older age, the natural sleep changes such that a lot of folks, it might be normal to sleep only 5 or 6 hours at night, wake up at 4 a.m. and take a nap during the day, and that's not necessarily abnormal as people age. I would say sleep is a little bit of an individualized thing too, so you have individuals in any age group who optimal amounts of sleep might vary by 2 to 3 hours, and so you got to figure out a routine that you feel good with and stick to it.
So we have about a minute and a half left and 3 questions, so bonus round,
Rapid
bullet,
fire.
one
All right.
question. All right. Vitamin D in the wintertime. How much do you need? Low vitamin D problems.
I'd recommend around here, it seems like 800 to 2,000 international units of vitamin D daily in general. Probably don't need as much in the summer in general.
All right. And symptoms of gallbladder issues. How's it diagnosed and options for treating it?
So typically you get pain in the right upper part of your abdomen. You might get nausea. Some people even vomit. Usually it happens an hour or two after meals. Diagnosis is usually by ultrasound, but sometimes we need another diagnostic test if it's not a gallstone problem. And surgery really is treatment if you're having enough symptoms. You don't always have to treat a gallstone.
All right. And last question. Man from Rapid City is type 2 diabetic and does not eat sugar or bread or use insulin. Is on Januvia, and I'm assuming glipizide, written here, but wonders why his blood sugars keep bouncing up and down. Any suggestions?
Well, if whatever you're eating, your body's turning some of that into sugar, and so that makes your blood sugars go up. And depending on how good your body is yet at making insulin to help bring that blood sugar down, it naturally goes up and down, and then the body naturally makes more insulin and doesn't. And if it isn't having the ability to make insulin anymore, or if the body's ignoring that insulin, that's when you have more up and down, and where the medications or insulin could be helpful.
Exactly. So talk to your doctor and they can have an extended conversation. All right. And now for the winner of tonight's Prairie Doc quiz question. If you decide to use the South Dakota Quit line to stop smoking, how many phone coaching sessions does someone normally have? A, 7, B, 5, C, 12, D, 9. The correct answer is 5. It was Lori Turgeson from Rapid City who answered the question correctly. Thank you, Lori, and for participating, and a book will be in the mail for you shortly. We'll be right back after this.
Because they want you to be there for the many milestones yet to come. Because you don't want to miss out on the little things. There are many reasons to get life-saving cancer screenings. 1 in 8 women will be diagnosed with breast cancer in her lifetime. But regular self-exams and mammograms can catch it early when it's most treatable.
Promise?
Promise. 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 Promise.
Make the promise to get screened. Do it for the people you love. For more information about life-saving screenings or available financial assistance, visit getscreenedsd.org.
When I was in my 3rd year of medical school, I learned one of my most important lessons. It did not come from a textbook or from a teacher, but from a brief conversation with a patient on hospital rounds. How long have you had diabetes? I asked. It was a simple enough question. Diabetes often progressed with time, and the longer it was present, the longer the cumulative damage. I wanted to gauge if his foot infection was a new issue or part of a larger battle that had been going on for months to years. "Thank you," he said. I was confused. "Thank you for what?" I asked. That was not the answer I expected. "For asking me how long I had diabetes and not calling me a diabetic," he said. Now, for all intents and purposes, for me, as a third-year medical student, the questions were identical. I did not realize there would be any significance to the phrase I chose. My patient continued. "Diabetes is something that I have, not who I am. It does not define me. I am so much more than this disease." This gentleman's, my patient's, comment made me pause. When I walked into his room, I had lots of data about him, but no knowledge of him. He went on to tell me about his life, his family, his prior job. He spoke of all the things that changed after his diagnosis and all the things that stayed the same. He was no longer the diabetic in room 26, a task that I must complete. He was a person who needed my help. He had a name and a rich history that the medical chart did not record. This quick conversation completely changed how I interacted with him for the rest of his stay in the hospital and every patient encounter since. I have a gentle reminder for you and me, like my gentleman gave me all those years ago. You are not a disease or a chronic illness. You are a person who is looking for help to improve your health. It is easy to let a chronic illness become one's identity and all that is talked about at a clinic visit. Remind us that there is so much more to your story. Sometimes we get busy and forget. We doctors are human too. A big thank you to our guests, Dr. Kelly Evans and Dr. Andrew Ellsworth, for joining us in the studio to answer the wonderful questions that you all called in tonight. The flu has really taken off with 158 new cases in South Dakota this week. There have been 29 new hospitalizations with a total of 138 so far this season. Sadly, there have been 6 deaths. This is a serious concern. The flu shot will help. Even if you do come down with a strain of the vaccine will help with the severity of the disease. If you haven't had a flu shot yet, get it now. That does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people.
There are few things more scary than not being able to breathe as you should. Why are you short of breath? Next time, On Call with the Prairie Doc.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota.
and with ongoing support of these individuals and institutions.
Brookings Health System,
Ophthalmology Limited,
Avera Heart Hospital,
Dakota Allergy and Asthma,
Fishback Financial Corporation,
Vance Thompson Vision,
Aberdeen District Medical Society,
Black Hills Medical Society,
3rd District Medical Society, Brookings, Madison, and Flandreau,
the Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
and Swiftel Communications.